My name is Dr. Prashanth Bagali. I head the scientific and medical affairs in MedGenome. Today, I will speak about the breast cancer prevalence and lifetime risk in Indian women. Breast cancer is one of the cancer in the woman which is having a high mortality rate. Breast cancer is 1 in 28 women, although we have a less incidence in India compared to the global, but the mortality rate is very high. So lifetime risk of breast cancer for the rural and the urban Indian woman is, there is a big difference. So the urban Indian women have a higher risk of breast cancer compared to the rural woman. So this is mainly because of multiple factors. So the factors can be because of the busy schedule, some of the lifetime risk and the hormonal therapy, or there may be a stress, or maybe some of the reasons which are related to the genetic and the non-genetic reasons. So here the people might think that the breast cancer is only for the women affected people, but however the men and women both are equal risk, because the hereditary genes what we receive from our parents are equally manifested in men and women. But however, the male breast cancer is very rare, or very less time is reported compared to the female breast cancer. So one important symptom which the woman should always ignore is at the different levels of their life cycle. So either it may be the monthly periods or the menstruation cycle, or it may be the pain in the breast. So these are some of them which they think is routinely available, but they are the high risk factors. So any of these risk factors persist for more than 2 to 3 weeks, they have to consult the gynecologist and take the medical practitioner's help. So many people would have seen that the two genes, always they are reading in the newspaper about the breast cancer, BRCA1 and BRCA2. We call it as BRCA1 and BRCA2 genes. Yes, these two important genes are very important, because about 3 to 5% of the women who are carrying this will definitely have the cancer. But however, in the lifetime, they can have a lifetime risk of around 65%. So breast cancer, not only the breast cancer, they will also get the other gynecological cancers. So this is very important to have the genetic testing done by all the women, and therefore the screening play a very important role. So screening, we have different types of screening for different age groups, depending upon there is any of the family members are having a breast cancer. So if there is no family member also, we have to undergo the screening. So the one important screening which I always advise for all the busy women who are all having a busy schedule, or who have a obesity or a specific, say like a smoking or an alcohol history, they should get the mammograph done. So mammograph is very important, because once in 3 years they have to get the mammograph done up to the age of 40 years, and after the age of 40 years they have to get annually. So in some cases it becomes very critical that along with the mammograph, the doctor might advise you to have a proper self-breast examination. So this is a very routinely done in the privacy of your home, and this play a very important role in the monthly they can examine, and if they find any changes in the morphology or any kind of unusual things, then they can report to the gynecologist. So these screening tests will, and the awareness, what you have the awareness within the family members, will really bring a save your life. But however, the genomic testing play a very important role, because many people, they say that none of our family members, like my mother, sisters or grandmothers, never had any kind of these kind of cancers. Why do I get this? So please remember, around 40 to 50% of the cancers at the elderly woman, like more than 45, or at the menopausal age of like 55 onwards, they always get the breast cancer which is non-hereditary. So there may be some reasons are known, some of them are unknown reasons, but there we have to do the genetic testing. But if you do the genetic testing at that age, then definitely there will be a higher survival rate, and that genetic testing will help you in getting the precision treatment or a personalized treatment. So this is very important. So what I would like to conclude is be aware about this and speak about this. Don't be silent. Talk to your parents, talk to your friends, and make sure that you get the early diagnosis, which not only save the family but save the country.